If you are a new network member, welcome. Typically, the last couple meetings, we have gone through sort of an overview of how this came about and the purpose. We're not going to do that today, but just know when we break a little bit later, we will. I'll stay behind. Hannah, I'll stay behind, and then if you have any questions, we're happy to kind of dig into those at that point. But again, welcome to everybody. If you're new, definitely welcome. Thank you for coming. We're excited today to have some time in our breakout rooms, but we're also really, really excited today to feature Andrea Day, who is with us. Andrea is the Assistant Director of the Kentucky Division of Child Care. She is also graciously volunteers her time to be an adult attainment guiding team member. But also, she is just a wonderfully nice and helpful human and has so much vast expertise around childcare supports in Kentucky. And so she is going to spend some time sharing a little bit with us today what's available, how can students access it, but also maybe a little bit of the current landscape across the state. Thanks to those of you that have sent in some questions for her. She is going to do her best to cover as much as she can. And so, Andrea, I will turn it over to you. Do you want any support with slides? Happy to.
No,
Okay.
I decided to do this for just talking because sometimes I get lost in this. And so uh, I'm just going to do an overview. Like Tracy said, she did send me some of the questions that I will address that you guys had, but please feel free to interrupt me to ask questions. I know I'm not good at waiting till the end to get back to something. So just throw up your hand or put it in the chat and I'll try to pay attention. Um, as Tracy said, I'm Andrea Day. I'm the director for the Division of Child Care within um, the Cabinet for Health and Family Services, Department for Community-Based Services, which is a whole mouthful. Um, but here at the cabinet is a very large entity that covers anything from aging and independent living to children with special health care needs to public health to Medicaid services, you name it. If it touches a family or health, um, we're overseeing it. Now, within the cabinet, our vision, and you will hear Dr. Stack talk about this a lot, is to create a commonwealth where every Kentuckian reaches their full human potential and all communities thrive. Um, that is that's what the purpose for all of us that do this work is, just to support families in the best way that we can so that we have thriving families and communities. Within the Department for Community-Based Services, we are a very large department, over 9,000 or sorry, 5,200 employees total. Um, we are divided into 7 divisions, and that's the Division of Administration and Financial Management, which they handle all payments, all contracts, all the messy stuff to get the work done. There's my division, obviously. There's the Division of Family Support, which oversees SNAP, TANF or KTAP, as well as LIHEAP and medical eligibility. There's also the Division of Guardianship, which handles vulnerable adults and those who need help managing their own finances or their, um, daily living task. We also have the Division of Prevention and Community Well-Being, the Division of Protection and Permanency, which is Child Welfare and Adult Protective Services, and then our Division of Service Regions. And while that's a lot of people, the Division of Service Regions are probably the folks that you guys are most familiar with. Those are the folks that are out in local communities taking applications for our programs. We do have offices in all 120 counties, but that's where the bulk of the work gets done. With the Division of Child Care, our we are the lead Child Care and Development Fund agency, CCDF. That is the federal funding that is provided to support low income and working families. We support all regulated childcare programs throughout the state. And when I say regulated, I want to be very clear. Regulated care is child care providers who care for more than three children who are not related to them. Unregulated care, that could be like, your next door neighbor that keeps two kids that they don't have to be regulated because they care for three or fewer children. Now, when we're talking about regulated and unregulated care, the biggest, well, not maybe not the biggest difference, but with regulated care, they have to follow a list of health and safety standards, professional development standards, um, health and safety, all the things. Unregulated do not. And regulated childcare providers are the only ones who are eligible to receive CCAP funding, CCAP being the Child Care Assistance Program. Um, Now, when talking about child care and regulated care, there are a number of different types of providers. You have licensed type 1 providers, which are our large facilities. They care for, you know, 25 to 300 children to fit, depending on the spaces, and that's in a non-residential setting. We also have licensed type 2 providers, and those, the primary location is in the residential area. They can care for no more than 12 children. We don't have very many of those, but I would be remiss if I don't mention them. We also have our certified family child care, and those are in-home providers. Those are our small businesses that typically women running out of their own homes. Um, it's a way for them to support their local community while also adding to their household's income. Um, they can care for no more than six unrelated children um, and no more than four related. So a total of 10. And I know all these details, you can find them on our website, but I just wanted to make you guys aware because when you think childcare and when you hear things in the news about something bad happened at a childcare, 9 times out of 10, those are unregulated programs where something goes wrong. And the term child care is applied to them, but they've not gone through all the steps for regulation. So it's very important that when you're working with students, that you make them aware of the different types of care. Again, that information is on our website, as well as the University of Kentucky Child Care Aware of Kentucky's website. That goes over what parents should look for when they are choosing childcare for their family. Um, One other type of provider that we offer, it's called a registered relative provider. Now, this isn't as popular or a lot of folks don't know about it, but a family member can receive CCAP payments for providing care to a family member, not their own child, and they cannot live in the same household as the child for which they are providing care. But that is also a way that we try to support families. I think we have 70 across the state. Um, we had dwindled down to less than 20, but that is something that, we have encouraged folks to do. Um, let's see here. What else do we do? We write all the regulations for childcare. Um, and those are based on federal law. We also partner with other state agencies to ensure that children have access to quality care and education across all these settings. We also participate in the Child Care Advisory Council, which is a small group of 18 individuals that represent parents, that represent the different types of providers that we regulate, as well as community members to talk about what is going on in childcare and how we can be better. We also participate in the Early Childhood Advisory Council, which is a larger entity overseen by the Governor's Office of Early Childhood. It's a 28-member panel that includes education, business, workforce, um, all of those entities to talk about how we make childcare better. Um, Now, within the division of childcare, we're broken into two branches, CCAP, which is the bulk of our work. Um, and so we have a claims section that reviews provider billing to make sure that the funding is being used appropriately and that fraud and misuse do not occur. We also have our payment section. Um, just like it sounds, they pay all of our providers. And then the policy and operations section. So they do write all those policy for us, and they oversee that registered relative provider, um, that group. They are their sole source. We also have the quality enhancements branch, which is made up of our All Stars, which is our quality rating and improvement system in Kentucky. So, just a little bit about All Stars. Those raters go out and complete observations in classrooms, and they are given a score uh, between 1 and 5, 1 being the lowest, 5 being the highest. Levels 3 through 5 on those scales are considered high quality. Currently, Kentucky has about 34% of our providers are considered high quality. So we definitely have some room for improvement, and that is something that we've been focusing on. In the last little bit, during COVID, we were very afraid that we were going to lose up to 40% of our providers. Thankfully, that did not happen. We um, we are where we were before COVID happened as far as our numbers go. So that is definitely something to celebrate. But there's a lot of work that still needs to be done in that area. Um, that the quality enhancements branch also includes the professional development and fitness determination staff. Fitness determination is just a fancy word for fingerprint based background checks. That is a federal requirement for anyone working in the childcare field to have a fingerprint based background check. And our staff review those records, if there are records, to determine if they are eligible to work in a childcare facility based on, again, federal and state regs. We also have the childcare health consultation group in DCC, which is new. They've moved over from public health. Those are nurses and health professionals that really serve as resources to our providers locally when they have questions about communicable diseases or the various outbreaks of sickness that occur in childcare. And we were just joking this weekend. My daughter went to childcare. My son did not. My mother-in-law retired and took care of him. And the difference in their two immune systems is quite crazy. My son, in a month's time, had flu B and then flu A, and still sounds like he has the croup. Whereas my daughter is like iron lung, nothing makes it through. She never gets sick. But anyways, those professionals serve our childcare providers, so they're up to date on what epidemiologists and the CDC are saying, um, and they pay very close attention to that work. We also house the Help Me Grow Kentucky program. Again, that moved over in the last year. It better aligned with our work. And what that is, it's a developmental screening tool that parents can use and providers can use. We are really trying to expand that program because we believe that educating our families is where that's where it's at. We miss it if we wait. Parents are our children's first teachers. They know their children, they are experts on their children. And so this is a way to provide them with tools to maximize their interaction with their children because we know that 90% of brain development happens between the ages of 0 and 5. Um, that is a fact that some folks, not to sound like I'm getting on a soapbox, but some folks really dismiss, oh, they're just kids. Once they start school is where we start. but we really miss the boat if we wait until school because children, their vocabulary, serve and return between parents, even though it may sound silly, that is how children are learning to speak and interact and how their cognition is developed. So we are really pushing that, advertising it more heavily. Also, we have partnered with our Division of Protection and Permanency about being better informing our own staff about the importance of early childhood education. It's not just childcare. Um, that's an easy um, attitude to have. And I've testified before that I was in that boat of like, oh, how hard can that be before I became a parent and had that responsibility. There's so much more to childcare. It mirrors public school as far as lesson planning, curriculum, activities, tracking those developmental milestones, making referrals for early intervention services. Um, so it is really imperative that we all recognize that importance. Um, so the Child Care Assistance Program, that's again, 70% of our work is probably about that. That's what you guys know the most about. The CCAP program provides funding to child care providers who accept families who qualify. They provide technical assistance to child care providers. As I mentioned earlier, process applications for the registered relative providers, process referrals from child welfare. We audit provider billing records to ensure that it's correct. And then we amend policy and procedures as needed to meet the needs of our families. Um, Here at the division, we are rule followers. So we've worked very hard over the past few years to be compliant with all of the federal regulations. Um, and we are closer than we have ever been before. And we're also willing to admit when we're wrong and make things better. And that is really trying to alleviate administrative burden for not only our parents, but our providers as well, so that they can focus on what's actually important, which is providing that care to children. Um, what are the requirements for families to receive child care assistance? So to qualify, um, the child must meet the age requirement, which is birth through 12 or age 13.
Hey y'all, and happy Monday today. I'm Niall. I'm a program administrator here at Decode Project, and today we're hosting some U of L student volunteers for MLK Day of Service.
Miss Whitlock,
Take a
you're
look at what
not
our
on
volunteers are up
mute.
to today.
Okay. All right. So the age requirement is birth through 12 or age 13 but under 19, and that's if a special need is present. They must be a current resident of Kentucky, and it's important to note the child must be a citizen or a qualified immigrant. The parent's citizenship status is not considered. Is the child eligible? Um, the parents must meet the work requirement by either working 20 hours or more a week for a single parent, or at least a minimum combined 40 hours a week for a two-parent household. Or they must be enrolled in at least part-time in a certified trade school or an accredited university or college. They must participate in the Kentucky Works or the SNAP Employment and Training Program. Households can also be deemed eligible through the referral process from the Division of Protection and Permanency. And those referrals are for families who may who may need intervention from child welfare, but providing protective or preventative child care could alleviate that risk. And so we do process those as well. One of the questions that Tracy sent in was, are there any stipulations on receiving child care assistance if you're taking online classes? And do online classes count towards any potential work requirement? That is one of the changes we've made over the last few years in that all education activities policies, they cover both online and in-person learning. There's no stipulation regarding the class format, only the required hours of enrollment and the institution type. Um, like I said, prior to COVID, we were probably a little stricter on that than we needed to be. But we were able to make those changes so that we could support those students because we know that even though they may be taking online classes, they need to be devoted, their attention needs to be devoted to that class and that learning environment. And having a little one is not conducive to that. Um, Even though, we worked at home with them, but it was definitely a distraction. So we are trying by making that policy change to support families in the best way possible. Another question that was asked was, do you have to use childcare in your home county? No, you don't. We have a lot of families, um, even in border counties to, say, Hamilton County in northern Kentucky. Parents, sometimes if they're working there, they want their child to be close to where they're working. As long as they are a Kentucky resident, their CCAP can be used in another state or in another county. We do not prescribe who they have to use or where, but to be eligible, they do have to be a Kentucky resident. Can a family use more than one center? Yes, they can. They just need to make sure that that schedule is clear when they are applying. Oftentimes we see that a family may only need care on Monday and Tuesday, but then they need weekend care as well. And non-traditional care is a challenge. And so um, we do allow for them to find care that best suits their schedule. Um, and are there policies for how many centers can be used within a year? There's not. But parents have to let us know who they are using. And those folks, like I mentioned earlier, have to be regulated and eligible to accept the CCAP payment. And then it says, can child care assistance be used for in-home, non-certified centers? Can a family member receive payment for caring for children? Yes, but again, they have to go through that registration process and be a registered relative provider so that we can make them eligible for those services. And again, I can't emphasize enough, if you are meeting with students, to direct them to our website or Child Care Aware of Kentucky's website to talk about regulated versus unregulated care. Because again, the higher quality and the health and safety standards that are in place with regulated care make a big difference.
Andrea, do you care if I
No,
stop?
right ahead.
I just had a couple of clarifying questions. Um, one of the things that this group has been talking about is, how sometimes students need various types of care. And I'm wondering if there is a way in which, so I have two questions. Is there a way in which the students could split types of care per one child? For example, you use that child care center on Monday, Wednesday, you use grandma on Thursday and Friday. How does that work? And do you all see people do that successfully?
Um, it can work. Again, grandma would have to want to go through the registration process. Um, and, but yes, they could do multiple types of care. Again, it really hinges on grandma going through the process to accept that, and then those schedules being entered by our family support staff for that eligibility piece.
So as long as the time doesn't equal more than so many hours, is that how that works?
It's based on the family's need. But I tell you what, Robin, I will get an official response from our CCAP policy folks to
Okay.
give
Yeah.
a couple of examples of how that would work. Um, Sometimes I know enough to be dangerous, but I don't want to give you the wrong answer. So I will have Amy Conquest write up a formal response.
And I would love to the process in which that you get that certified registered family provider.
Okay.
Is that on your all's website, do you
It
think?
is there as well.
Okay.
And again, Amy Conquest is the point of
Okay.
contact for that, but we can definitely,
So it has to be a family member, can't be like a friend, right?
it is a family member. And I'm going to be very more transparent than I probably should be. We used to just have registered providers to where it could be family or not. Um, we were in non-compliance for that because according to the federal rules, if it's a family member, then all those health and safety standards and the professional development doesn't have to be earned because they are a family member. But when it becomes a friend, that changes it. And that's how I don't want to say we got in trouble, but we weren't doing it correctly. So we did make that change to registered relative. But if they do have a friend, we also have certified childcare providers, and we have a staffed family childcare network across the state. There are 5 different hubs across the state that work very closely with those that wish to start a program in their own home. Again, they're small. It's, no more than 10. Um, and so we've really put some resources there to educate, again, it's normally women, on what it means to, sorry, what it means to be a business owner, how to make a business plan, how to get all the things that you need, how to navigate um, building codes and local ordinances as far as starting a business in their home. Um, so, so that is available too, and we've seen a lot of success with that over the last few years. And then,
Andrea, I'm sorry, just a quick question. When do you see, I know in the, of course, the licensed bigger childcare providers, there are partnerships with employers. Do you see any partnerships with industry employers with those family friend neighbor providers? I was just curious, and the reason I'm asking is because we all know there's just so many childcare deserts in certain parts of the state.
yeah, as far as the registered relative provider, no, not as much because again, we have that stipulation that they have to be a relative. So then that kind of reduces how an employer could use them, if that makes sense. But that certified, we are seeing more businesses utilizing that, especially in our rural areas. Well, and I say especially in our rural areas, Jefferson County in itself has the most certified family childcare homes that serve. There's over 100 there, and some of those are Spanish speaking only, which serves that population. But again, the certifieds, those are more sustainable and easier to stand up than a huge licensed facility. So providers have been using, or employers have been using them. And then that gets me into the Employee Child Care Assistance Partnership Program, which is a state funded opportunity to where businesses can choose to contribute towards their employees' child care cost. And they can pick whatever they want. If it's $50 a month, if it's $500 a month, the state will match that contribution up to 100%, but no less than 50%. There's a lot of sliding fee scales there. Um, and I want to point out too that that is for families who do not qualify for CCAP. Because if we get one of those applications in and the family we see that they qualify for CCAP, we're going to refer the family to CCAP because they're going to get a greater benefit. But the Employee Child Care Assistance Partnership Program was a way for us to engage the business community because childcare isn't just a family issue. It's an economic development issue. It's a workforce development issue. It's an education issue, as you all know. And so it was like, how can we get them to realize the importance and for them to see that return on investment of if their employees know that their children are safe and cared for during the day, productivity goes up, absenteeism goes down when folks have reliable childcare. So that program has been around now for, I think we're going into our third year with that. It's still very small and underutilized, but we continue to try to grow that. And then I see here that we also, how do you determine if they're a family member? There are guidelines that are established for that, that are, again, it's part of that packet. And what I can do is get that packet and share it. Tracy, if you don't mind, I could share it with you to disseminate to the group, so you can see that.
I had actually asked that question, and I guess I was more so thinking about, the dynamic of families are all different. And so, I think about just my own family. My mother is mama, right, to her biological grandchildren, but they have siblings that she is also, considered their grandmother as well. But biologically, she's not related to them. So I was just kind of curious, like
Step
how does
step
that work?
is considered as well.
Okay.
Yeah, yeah. But it can't be like, and I'll just use myself. Growing up, my dad's best friend was quite a bit older than him, and uh,
Sure.
my papa was 40 the year I was born, and they thought it would be funny for me to call him papa at 40 and make him feel old, even though there's no biological or step connection. So like they wouldn't be eligible, but if there is
Sure.
some kind of familial connection, whether by birth or marriage, that
Okay.
covers them.
All right. I was curious about that. Um, and then my other question that I did not post is in reference to the program you were just talking about. You said it was the employment
The Employee
and
Child Care Assistance
em
Partnership.
employee child care assistance partnership. Okay. So if someone comes to you all and they don't qualify for CCAP, will the worker that is helping them with that case, will they automatically like know to tell them to apply for this other thing? Or is that
In a
something that the
perfect
person needs to
world,
advocate? Okay,
in a perfect world, yes, they would tell them about that. But I will say our family support staff at the local level do not
sure.
handle that, and that is a function here in our office within our payments section that they handle all of that. So I can also make sure you have that email box for
Thank
any
you.
questions.
And I'm sorry, can you give it to me one more time?
I know. Hold on, let's do this because
Okay,
it's a mouthful, and we didn't get to name it. I'm just going to tell you that
it's okay.
uh,
It's all
because
right.
it's nothing like having C cap and
There
then
we
you
go.
come along with an E cap, and it's like, what cap do I need? Again, that's what we're working with right now. Um, we
Okay,
were we weren't the first state to try this program, but we were the first state to pilot it at a statewide level. Um, Again, it's small. I think we serve 120 families right now. Um, but it's something that the Chamber of Commerce is very much behind, the Kentucky Nonprofit Association, several different, but it's just getting that buy-in from employers to think differently and to think about, why this is important to them. And we hope to continue to see that grow. I think it will be a topic during this legislative session, um, as uh, as the session moves on.
okay.
I have a question for you. You mentioned that participants can be attending college classes virtually or in person, and that will qualify them for the program. What about those participants that do not have a high school diploma or GED? Attending GED classes will qualify them as well?
Yes. And that was something that was changed during COVID as well. but as long as they are seeking education. And I'll get those guidelines for you, GED eligibility. But I can get that to you, Ms. Marsh.
Thank you.
What about if they're, because I work with Christina's son, what about, and I'm sorry to interrupt, what if they're working in ELL or working on an IET program? Because that's an educational component too. I know SNAP allows that now, the SNAP ENT program. I didn't know if it was kind of similar or not.
Tara, if you don't care, drop your specific question in this way I don't misrepresent it and I get it correct. I'm
Okay.
not familiar with the acronym ELL or IET.
It used to be English as a second language. Now
Okay.
it's English learning language.
Okay.
I forgot what the other L stands for.
English language learners.
Yes,
Okay.
yes,
English
thank you.
language. Okay.
And the IET is just like if they're working on their Serve Safe or paraeducator, like a
Okay.
small free certificate that adult education works with, that's just in amount of a few weeks.
Okay.
Will
I
stop.
will take that back.
I just wrote blank. Never mind.
It'll come back to you, and when it does, just yell it out. Okay. Let's see. I've gone over that. One other thing that I would like to throw out here just to make things even more complicated, and we don't have a pretty acronym for this. But Kentucky was the first state to make those individuals who work at least 20 hours per week in a regulated child care program, we exclude their entire income from the CCAP application process. That was something, not to get overly in the weeds, but that's something that we all know. Child care is one of the least paid industries. Professional dog walkers in large metropolitan cities make more than child care employees. As crazy as it sounds, it's true. 98% of the workforce makes more than child care. So during COVID, we really saw our providers struggling to find folks to work for them, to compete with big box stores or the hospitality industry, because they could make $15 an hour at Target and have some benefits. And where they were making, let's say, $8 an hour in childcare with no benefits and a very exhausting physically and emotionally and mentally job caring for children, for every minute of a day. So we were like, how could we help providers recruit and retain a workforce? And so this is something that we did under the federal grant, Child Care and Development Block Grant, was to make them a protected population. Now, again, they have to work at least 20 hours a week in a child care program. But then again, they have free child care at that point, and their provider isn't having to provide a scholarship or a discount. So it's not impacting that provider's bottom line. That was also a way to attract folks to childcare. And then we're able to couple that with the early childhood development scholarships, which I know hopefully you all are aware of, that if someone is working in a regulated childcare program, that they can pursue a credential, a certificate, their associate's, bachelor's, and up to a master's degree in IECE, the interdisciplinary early childhood education. And we saw a lot of folks take us up on that offer, and they continue to do so, to the point that we secured an appropriation during the last budget cycle of $2 million per year to fund those scholarships. So again, to build that workforce. Does that have to be at the child care center the employee works? No, it does not have to be. It's just as long as you are working the 20 hours, if you don't want your child to be there with you, and let's say it's an after school program that they're going to go to at their school, that would qualify as well. The professional development and fitness determination, I know you guys probably aren't as interested in that, but those folks that do work in childcare are required to have a professional development plan every year, and they must obtain 15 hours of additional training per year. Our professional development and fitness determination section reviews that. They also process applications for trainers' credentials that we offer in Kentucky to levels 1 through 5 again. Level 5 being pretty much a master trainer, if you will. But that is very important. That way, folks get those foundational skills that they need and are able to build on those and grow their career and take advantage of other opportunities that are available to them. I talked about All Stars. We also, I want to point out, we are partners with all kinds of folks. There's 37 different state agencies that touch early childhood education, which is a lot, but we do partner closely with the Department for Public Health, with the IDEA Part C program, First Steps in Early Intervention. We also partner with the Early Childhood Mental Health Specialist. We partner with the Governor's Office of Early Childhood. We're also part of the Advisory Council for Pre-K for All, the Governor's newest initiative, and are working to try our best to align not only childcare but Head Start and public preschool. And that could be another meeting and all of like a half-day meeting to talk about all that. I won't get into that. But that's kind of like us in a nutshell. And I know that was a very large shell. What other kind of questions do you guys have for me? I'm happy to answer.
Andrea, I don't know that we know enough yet to even answer, but I was curious do you know whether the workforce Pell will those um, courses, certificates, pathways, will those be covered like the GED program and like, of course, higher education?
I am not for sure. I don't
And
know.
it's just yeah, it's probably too early. And then the second question, and again, have you heard anything about any interest in micro licensures?
So I will say that um, there has been talk or interest in like micro learning pods, if you will, and micro credentials, but it's still early in those discussions. Um, and there will be more to come on that. We have recently transitioned from ECE TRIS, which was operated by EKU for 40 plus years. And so we are redoing our TRIS system. It's currently still called KY TRIS, but we'll be looking to modernize the availability of trainings. And so I know that micro badging and credentials has come up there. Like I said, as far as micro licensing when it comes to programs, there is a bill that is currently proposed. It's not something we do right now, but I can't say that we won't.
No, thank you.
Uh-huh. David?
I just wanted to pop in there and say that in response to Tracy's question about workforce Pell eligible programs, there's a lot to be said and decided about those programs, but they ought to be just like any other program of study in the post-secondary space because they have to be an accredited program. So, they're a regular 3 credit hour program, and so it should be just fine for eligibility purposes. But I am interested to hear what Andrea has to say when she has a look when we decide things at the state level.
Yeah, absolutely. And please, that's the first I've heard of it. So any information you have, shoot it my way. That way, our staff can be looking at it and we can be preparing for that. Um, again, I can't promise that, oh yeah, absolutely. But what I can promise you is that if it's out there, we want to know about it and see how it could fit. Because again, it's all about eliminating those barriers and supporting our families in whatever way we can. So, if this is something new that we do need to be looking at, I do want to do that because, again, it makes your jobs easier and it really supports our families.
I have a question regarding consistency statewide. So, we have at EKU, we have, of course, primarily our Richmond campus, but we also have students down in Corbin and Manchester and then across the region. And we hear some differences in some policies regarding childcare, depending on the worker, the county. You know how it goes. You fight this all the time, I'm sure. And how, you know, it's very difficult to even be able to talk to the same person every time. What kind of advice could you give that we can pass on to students that would help with some of those inconsistencies that we know that's not the policy, but somebody's telling them that's the policy? Like, you can only move child care centers once a year, or you can't. I recently had this problem down in Williamsburg. You can only use one center, even though you have 3 kids and there's not room in all three, there's not room for all of them. I'm like, that's just not true.
That is just not true. You are correct. Consistency is a goal and it is a constant struggle. The policy is the policy, but how it's applied across the non-service regions, and that has to go with family support. It has child welfare. It's not a perfect system. However, I will say that over the last 5 years, childcare is more part of the conversation. We we are communicating a lot better with the Division of Service Regions as well as the Division of Family Support. We do offer a policy panel to where it's the supervisors and the public assistance program specialists coming together to hear the same message. There is one devoted now. This is the first time this year coming up that it's going to be all about CCAP. We're going to get our own like 4 to 6 hours. So I would suggest families can always reach out to our regulation inbox. That's not something we normally give out a whole lot, but that's how we find out what's not working. And we don't know what we don't know. And so if we can have specific examples of that, then we can work to release a clarification statewide about those things. I'm not trying to dance around it, but it's not a perfect system, but we are trying to get better, not only with eligibility, but we hear the same thing with licensing and how folks get cited at on the provider level. Like, what gets cited in Lexington doesn't necessarily get cited in Pikeville or vice versa, when really a rule is a rule and it should be enforced the same way. That is a struggle, but one that we are continually fighting.
Andrea, thank you so much for this information and your time. I will be sure and whatever you send my way, I'll send out to everyone. If you have additional questions, feel free to put them in the chat. Um, you can or you can send them to me. I can batch them and send them to Andrea, or send them, Andrea, if you want them to send them directly to you as well. I want to honor your honor your
Yeah,
inbox and your
I
time.
put my email there in the chat, so fire away, and we'll get those answers for you.
Thank you so much. Really, really appreciate it. We do have, of course, the Supports for Parenting Students work group. We do have our 5 grantee campuses that are really working to um, make long-term improvements to supports for parenting students. 63% of our students in Kentucky are parents. And so even though we've got one work group dedicated to that, it really is an issue that goes across everyone. So what we'll do is we'll transition into our work groups. We've got about Nan, if we could have about let's see here, about 20 minutes or so. I feel like we never have enough time. Then we'll hop back in, wrap up with just some aha moments from those groups, and then leave just a minute for a couple of quick announcements, specifically about the Student Success Summit.
And you all can pick your own room, but if anybody has issues, I can put you wherever you need to go. So I'm going to open them up.
Thanks, Nan.
Well, welcome back, everyone. It sounds like people had some good conversations in their breakout rooms. So while we have a second all together, I think it would be good to go ahead and share, like Tracy said, maybe an aha moment from Andrea's presentation today, or, if you all have made some progress on what you're thinking about as sort of your in project or something that you want to attack together, that would be great to hear too. And I can go first from our adult learner advocacy group. We, I think, have decided on what our final project is going to be. So we're digging into that, but we're looking at creating like an adult learner playbook. So this would be a very comprehensive list of resources or information that would be shared widely across the state, but customized for institutions. So I think this has been created in different iterations from different places. And so we're looking to create one where essentially, if you're working with an adult learner or you yourself are an adult learner, this would give you a good idea about, the different things that are available to you. So one that Amber brought up was just having all of our programs across the state that offer credit for prior learning and what credit for prior learning is, how that can be used. And then this would work in conjunction with Futurity, which is the online program that connects students to these resources across the state as well. So yeah, we're still kind of fleshing out what we want to include in that, but we kind of just kept coming back to like, we do so many good things across the state, but no one knows about them. So how do we get this information out in a way for students to access and for, people who work in community organizations or institutions to access as well? So I'm trying to think who comes next, but I see David in front of me. So I'm going to call on David's group to share out. And it doesn't have to be David, but I just see your face.
That's okay. Thank you, Hannah. So today was Channing Lawson and Chris Goodman. We were talking about adult transitions. It was great to meet them both. They are both relatively new to their roles at Eastern Kentucky and the University of Louisville. So we were just talking about what the landscape looks like in terms of transitions across the different stages of our lives and brainstorming additional issues that those learners are facing. One thing that came up today was accessing high school transcripts, especially for international students, and what that looks like, and the institutional barriers in place that are stopping those students from moving onward. So it was a great meeting, but it was lots of getting to know each other.
I'm going to jump in, David,
Yes. Yeah,
for
please,
the
Matt.
transition on the CPL team. And I first want to say thanks to Andrea for joining us today and sharing all the wisdom and insight from your office. I really appreciate all the work that you all are doing. And then thank you for sharing that out to this group. On our front, CPL, we had a similar theme on international, and that was IB, mentioned by Carol Meeker. And I gave her a suggestion of maybe submitting proposal to the Student Success Summit to talk about best practice in IB and how to expand policy that will leverage IB at a greater clip across the state. That said, I think IB, AP, West transcripts, CPL, and those things that we can make more standard across this state through both the handbook that Hannah is going to curate with her team, and then also the listing of the CPL practices that we can adopt at other institutions that aren't doing as much, knowing that it exists, it's standard practice, and then it's easily adopted for bandwagon reasons, will keep pushing us forward as a kind of collective and a commonwealth. We talked as a group about the fact that we are industry or university neutral in our effort to try and get more adults back to and through, because there are plenty fish in this pond, and there are many people with some college and no degree that if we create efficient pathways, they will reconnect with us. So if anyone else in my group wants to jump in and say anything, Cassie Bradley is a statewide all-star in CPL. If you need anything, she is so immersed in this. She will make your life better if you have a conversation with her. Passing it off to another group.
I can speak a little bit from the Child Care Solutions group. We took an opportunity to talk to Andrea some more while she was in our session as well. And one of the common themes kind of was coming back to making sure that all students know what their resources are. And our friends there at Morehead State were discussing some of the things that they're going to be doing for some resource guides and et cetera. And we discussed how to potentially look at some partnerships either through the community colleges or through community action agencies to use those connectors that are in our areas a little bit more, being more intentional about getting some of those that information out to parenting students. And that was basically the majority of our conversations today.
Thank you, everyone. It sounds like I said, everyone had great conversations today. So we'll have more time, as always, in the next meeting to check back in with your groups. But also feel free if there's things that come up in between now and then, feel free to keep working with your groups or send it to the whole group if it's relevant. But yeah, thanks for your participation.
Thanks. Excuse me. Thanks, everybody. And thanks, Hannah. I'm going to share my screen just a second with a couple of announcements. Maybe.
Tracy, while you're pulling up that, I want to just do a quick plug for a book that I'm writing currently with Bridget Strickler, formerly of the Graduate Network and Kale. It's called Beyond the Degree, and it's stories of adult learner comebacks. So if you have individuals at your institution that need to be featured, their stories need to be heard, please send me an email at matt.bergman@louisville.edu. And I would love to feature stories from your adult learners that has had success. Sorry, Tracy, go ahead.
No, that's great and perfect timing. So just a couple of really quick things about the Student Success Summit. It is March 23rd, 24th. The University of Louisville is hosting this year. A couple of dates that are coming up. We heard from you from the field that there was a desire to hear from Kentucky specific initiatives this year. And so we are wanting to highlight those initiatives. So session proposals are open. If you have something that you want to share with others that's really working, particularly in the adult learner space, please feel free to consider a session proposal. There's information about that. We can drop that in the chat. Nan, if you are with us, if you could just drop the link in the chat. Sorry. And then also we've got award nominations this year. So this is also a little bit different this year in that we are requesting nominations for specific awards. These cover individuals, teams of folks, cross-sector teams of folks, or cross-institution partnerships, and then innovative initiatives. So if you have someone that you would like to nominate, or if you would like to nominate yourself, totally allowed, please be sure and get those in by February 6th. We are also hosting, it's the highlight. Those of you that have been to the summit know this already. It's the highlight of the summit. We are hosting our student panel. If you have a particular adult learner that you would like to nominate to be on this panel, just let me know, and we can be sure and get the form and the link out to that student, either through you or directly to them, with permission, of course. We don't know how much interest we'll get. We've got, probably about 5 slots available. However, that does not mean that we will not be able at some point to highlight any adult learner that's interested in telling their story. Again, through what Matt just shared, or also through this group as well. So be sure and just send those our way if you have anyone you think you'd like to nominate. And then finally, we have, for those award nominations, we would really like for those that are doing this work to be the ones that are actually part of those selections. If you are interested in serving as an award nomination reviewer, and you are not a senior fellow, please let me know, because we are looking for folks that would be willing to volunteer a little bit of time to review those. We'll have a rubric, and I don't anticipate this taking more than an hour of someone's time. But again, that just depends on how many we get. So just feel free to reach out if you're interested. And then finally, last thing, our next meeting is February 17th, featuring Tracy Robinson. I have put just a tiny bit about Tracy on that slide. However, Matt, you have worked with Tracy for many, many years. If there's anything you want to share, please do. I was part of a session that she did at Kale, and it was phenomenal. Much like Andrea, Tracy comes to this work as just a very authentic person who is willing to share all of the tips and tricks that she's learned along the way, particularly around credit for prior learning. And she does. I would hold up the program at her university, University of Memphis, as one of the top in the nation. I don't know, Matt, do you want to share anything else about Tracy? I know you know her very, very well.
Yeah, she's a great friend and incredible practitioner of CPL. I consider her almost like the goat of CPL practice. So she has lived it from initial thought to full implementation and wide acclaim across the country. She has struggled with an office of one, and now she has a full team of individuals and major $1 million grants associated with external partners and large corporations to advance Memphis. So just know that if you come, you'll be dazzled by this fabulous human, Tracy Robinson. You're going to really love her. You'll want to know her. Her time is thin, but she agreed to come and hang out with us next month.
Thanks, Matt. And thank you all for your time. Final thing, this is a survey. We read these and take these very seriously to continue to improve what we provide for you. So would love for you to just take I think it's 4 or 5 questions to help us continue to improve our practice. And thank you so much. I hope you have a great rest of your week. See you next month.